Hello and welcome to our Love Data Week 2025 webinar, Making Others' Data Your Own, Adding Value and Promoting Interoperability Through Secondary Data Collection and Use. I am now going to introduce Megan, who will be moderating today's discussion and leading the Q&A afterwards. Megan Chenoweth is a data project manager at ICPSR for the Social, Behavioral, and Economic COVID Coordinating Center and the National Neighborhood Data Archive. I will now hand it over to Megan to get things started.
Great. Thanks, Chloe. Thanks, everyone, for being here today. Welcome to today's session. I'm really looking forward to our conversation today. Our session was inspired by the theme of this year's Love Data Week, which is whose data is it anyway? And we'll be talking to three panelists, all of whom have created really awesome data resources that are derived from other publicly available data sets, and all of whom have gone on to share those data resources through ICPSR. So when you're using publicly available data, it's tempting to think that you're best off starting from the source, that getting that data from its producer is the best way to get exactly what you need for your research question. But our panelists' data resources will show us some great examples of when and why that might not be the best approach. So we'll hear about some of the ways that they've enhanced and added value to the data that they began working with, and about the benefits that data users get versus going back to that source. So let me start by introducing our three panelists. Lindsay Guypen is a data project manager and curator within the Social Environment and Health program at the University of Michigan Institute for Social Research. Lindsay manages the National Neighborhood Data Archive, or NANDA, which is a collection of theoretically derived, spatially referenced nationwide measures of the physical and social environment, created in part from publicly available data sources such as census data, to name just one. We also have Caitlin Jackson, a senior statistical analyst at the Social Policies for Health Equity Research Center, aka the SPHERE Center, at the Harvard T.H. Chan School of Public Health. And Caitlin is a contributor to the U.S. COVID-19 County Policy Database, or UCCP, which is a collection of data on state and local COVID-19 related policies compiled from government data sources. And then finally, we have Laura Montanovo, an assistant professor in Purdue University's Department of Agricultural Economics, and an applied public policy researcher with interests in labor economics and public finance. Laura and her colleagues have created the Occupational Social Distancing Indices, a set of summary measures derived from publicly available Occupational Information Network, or ONET, data for characterizing jobs by their work from home capacity. Okay, panelists, let's get started. So to kick things off, I'd like each of you to give us a basic introduction to the data that you have deposited with ICPSR. So what is it? That's question one. What publicly available data is it derived from? And why did you create it? What question were you trying to answer? And I'm going to give this one to Lindsay to start with, and then Caitlin and Laura.
Sounds good. Thanks, Megan. So like Megan said, I work for the National Neighborhood Data Archive, and we have a number of publicly available data sets that are available. We use all kinds of different public data, and then we have a geospatial data analyst. Internally, we refer to him as our data wizard, who geocodes the places of things and then makes a tabular data set so that folks with a research question about place, specifically at the neighborhood level, can use our open data sets to answer that. So for example, we have one measure in our socioeconomic status and demographics data set on affluence, disadvantage, and ethnic enclaves. That uses the United States Census data as well as the geography shapefiles on the United States Census as well. We also have one on essential workers. We've got one on voting data. We've got stuff about like how many grocery stores there are in neighborhoods, all kinds of different things.
Great, thank you. How about Caitlin next?
Yeah, sure. So hi everybody. So as Megan mentioned, I have helped curate and then work on some analyses with the United States COVID-19 County Policy Database. And I'm just going to refer to that as UCCP for the remaining talk. So UCCP has systematically documented pandemic era county level policies at the weekly level from 2020 through 2021 for a random selection of 309 counties in the US that cover all 50 states. And the weekly database has data on 27 specific policies, and those 27 policies have been organized into 3 domains. So we have containment and closure policies, economic policies, and then public health policies. And Megan briefly mentioned this, but the data, we derived the data using data collectors and trained staff to kind of go through systematically county by county and look at different local, state, and federal government websites, press releases, social media posts, news outlets, like all types of resources online to create the database itself. And then our primary aims were to help characterize geographic and temporal variation in pandemic era policies, and we all know there was a lot of it. And then we also wanted to support evaluations of policy effects on mental health, behavioral health, other health outcomes, and just even other outcomes in general, perhaps economic or educational outcomes. So we wanted to have a tool to help support other researchers in that type of research.
Thanks, Caitlin. Laura?
Yeah, so I started working on this data as a PhD candidate. We were trying to write the first research paper on the labor market effects of the pandemic. So we started working on this data set the month that the schools closed. And the idea was to try and figure out what characteristics of American individuals were playing the most important roles in their job loss during the beginning of the COVID-19 spread. And we wanted to try and figure out to what extent it was demographics per se, or how different people of different socio-demographic characteristics sorted themselves in different jobs. So we built indices from the ONET data, which is the Occupation Information Network production database, which is curated by the Department of Labor. This data set has several questions. It's a survey and has several questions on the type of tasks that each occupation engages in on the daily. And we used some of these questions to rank to what extent each job could be done remotely and to what extent each job relied on face-to-face characteristics. And we used the pre-pandemic answers to rank these jobs, because then we all know that during the pandemic, some jobs that were considered high in face-to-face interactions actually switched to being low in face-to-face interactions, like teaching, right? And we used these indices to rank different types of workers in jobs that could be considered more vulnerable during the pandemic. And we did, in fact, find that a lot of the demographic characteristics that explain job loss were actually just based on how these people were sorting in different type of jobs. So this became a paper. Many people were interested in the indices, which made us want to make them public.
Thanks, Laura. All right, so we've talked, panelists, about what led you to create your data, but now let's talk a little more about what led you to then share it. So Laura started touching on this for us to begin with. So who do you see your data helping or benefiting now, and how? I'm gonna start with Caitlin, then Laura, then Lindsay on this one.
Sure. Yeah. So, thinking about our data set, the UCCP, there are very few databases that have collected such local level policy data during the pandemic. Prior to our work, there was sort of a lack of consistency in how policy measures were measured and made available. And so we aimed to have the UCCP in a way standardize how policies were measured and quantified. And then we also wanted to support efforts to more rigorously measure policy effects on outcomes by adequately accounting for confounding due to the implementation or the expiration of many other policies, related policies, at once within this period of time. And then in doing so, also kind of increase the dialogue over within this policy landscape, what a policy exposure means, and also how to interpret the findings. So we really do see it helping researchers kind of solve some of the issues around conducting policy evaluations, especially within the first couple years of the pandemic.
My turn.
Thank you, Laura. Yeah.
Well, I think this was very much a audience-driven response. I started getting emails from researchers from both academia and non-academic settings to ask us for the indices. So then it came very natural to us to clean the data as much as possible and the do files and publishing them. I think we do two interesting things that can be considered service to the academic community in the policy realm, right? Number one, we did rank jobs by their social distance potential. And these indices have been used in several papers, not by us, trying to understand how COVID affected jobs, even in the longer term, compared to what we were doing, which was very much the first few months. The second, I think we found a really straightforward way to use the ONET data to rank jobs. So this allows researchers to kind of easily rank jobs according to other metrics that they're interested in. There's hundreds of questions in ONET, and we're assuming that people might be interested in different types of job characteristics. So I think this was a useful effort, and I'll talk about later more about what made the job hard and what instead was more straightforward to get done.
Yeah, thank you, Lindsay.
Sorry, my mouse froze. I couldn't unmute. Okay, so NANDA was created by an epidemiologist, Dr. Philippa Clark. She's in the audience today. And she was doing neighborhood research and creating an index of socioeconomic status, affluence, disadvantage. And she realized that a lot of her colleagues were doing similar work. They were also creating these data sets to use for their own research. And she thought, gee, wouldn't it be great if there was one of these that was publicly available that we could all use? And so that's kind of how now NANDA was born. Since then, we've added all kinds of other data sets. I mentioned our essential workers data set. There was an ACLU paper or article that was used to sort of talk about jobs that were classified as essential work jobs. And of course, a lot of researchers have the question of, well, how is that impacting folks in the neighborhood or in their communities? Where are folks with essential workers living? Where are they at? So we created a geospatially coded data set that's organized by the place. So when we say neighborhood, we either mean like a census tract, a county, or a zip code tabulation area. It sort of depends on the source data. I believe that one is at the census tract and zip code. But essentially, if you are asking research questions, if you're doing a survey or you have medical records, if you're using the health and retirement study, and you know where the folks that you're researching lived or worked, and you know their address or their zip code, NANDA has tabular data about place that is at the census tract, zip code, or county level that you can easily link with your own data to answer questions about place. How is that useful for other folks? Well, not everybody can do geospatial analysis or geocoding themselves. So we're sort of trying to eliminate that step for folks so that they can get right to the tabular data to answer their questions. And then as far as, maybe I'm getting ahead of myself. I think I'm getting to the next question, sorry. Yeah.
No worries. No worries. We'll get there. And I think you get to be the first one for the next one. But first, I just, if I just could step back and just highlight a couple of kind of common themes I see across your answers, in terms of, what's the driver behind sharing. I love the point that Caitlin started about data sharing as a way of addressing kind of a lack of consistency. And I heard echoes of this in Lindsay's response as well. If everyone starts from the source, we miss an opportunity to be consistent with one another. Laura, I think I heard this in your response too, in terms of providing a model for, if folks are not interested in work from home potential, but in some other aspect of jobs from that ONET survey, that they can use your approach as a model. So I just think that just wanted to kind of highlight that kind of common theme across what the three of you are talking about. And also I love the very practical kind of audience driven mention that that Laura made. It's much easier that the interest in sharing the data came from kind of a demand for that data from other people, and data repositories like ICPSR can be a much simpler and better way of getting data out to other people and making it accessible, rather than trying to share what you did with individual researchers over and over again. Okay, I just wanted to kind of highlight those couple of things before we go on. But the next thing I wanted to talk about is kind of getting back at the theme of our conversation today, which is making others' data your own, or adding value to data that's publicly available elsewhere. So in each of your cases, there are things that a user can get from your data that they couldn't get by going back to the source. So work that you put into improving it, insights you derived from it that are reflected in the data that you shared. So I'd like to invite each of you to tell us a little bit more about the ways in which you've added value to that data. And then to follow up on that, do you see any ways in which someone else could build on your data further? Are there further improvements or value that can be added? So Lindsay, I'm going to start with you.
Thank you. Yeah, so I talked a little bit about how our data is about place, but you don't have to know how to do ArcGIS or other geocoding in order to use the data. So I think that's kind of the first and foremost thing. Additionally, our index, our socioeconomic status and disadvantage data set that I was mentioning, affluence and disadvantage in there, our PI, Dr. Philippa Clark, did a really detailed statistical analysis, a factor analysis, to figure out which variables it made sense to combine into those indices. We have a paper published about that, a technical paper talking about the statistics. But there are other indices available. There's a social vulnerability index and the area deprivation index. But they don't necessarily work as well for public health. And also they just kind of put the same variables together. They just sort of grab a bunch and stick them together. Where ours uses the statistical analysis that you can go back and look at yourself. You can recreate those steps yourself. If you disagree or if you came up with a different solution, you could pick different variables to put together if you had those skills. So that's one way. Additionally, one thing that we do at NANDA that I'm very proud of is we make very detailed user guides that we publish alongside our data sets. ICPSR always does this for us. They make sort of a summary statistics file that talks a little bit about the data, but we publish a secondary one with all of ours that talks about our methods, the research that we did, why we created this data set, where the ideas came from. So if folks wanted to recreate the data set or they had a slightly different take on it, they could take that methodology and learn about where where we started from to sort of recreate it. We don't publish our code yet, but it's something that we are working towards and may potentially do in the future.
Thanks, Lindsay. Laura.
So the value that we added, I think it's twofold. One, it's more qualitative type of work, and one, it's more like very tedious, and I'm so happy I'm sparing people of that. The qualitative work is we had to go through the ONET survey and pick the questions that we thought would be relevant to build a remote work and face-to-face index. So we had to identify the questions, and I think the valuable part in that is that we tested different types of questions, and we validated our indices by doing some robustness checks. The tedious part is there's two big ways to classify occupations in the US and also outside of the US. One is called the SOC, and another one it's the census. And the ONET uses the SOC occupation. The CPS survey, which is the main high frequency survey in the US, uses the census. And we had to link these two data sets. So we built a crosswalk that would take you from the SOC codes to the census codes, which was annoying, but we managed. So this, I think, it's the value. There is nothing intrinsically technically hard in this data procedure, I wouldn't say. Something that I've been thinking about, but you know, our job just makes it hard to prioritize things. And so if researchers are interested, you know, they could jump on this train, is, you know, we are classifying occupation based on their tasks before the pandemic. So if you went to a teacher and you were like, how often does your job involve face-to-face interactions, then they would say very, very often, right? But then the pandemic kind of switched some of these jobs to being more flexible or maybe even completely remote. And I think it would be nice to do something similar to what we have done, but using the time dimension of the ONET survey to study which jobs actually went through this transition. So I think that's some low-hanging fruit, not really low-hanging, but there's some like an untapped value that can be explored and exploited further.
Yeah, thank you, Laura. Caitlin, how about you?
Yeah, so I think one of the main areas in which we've added a lot of value to this data is pretty much the time that was required to put into consolidating this level of data across 309 counties, 27 policies, 2 years of data at the weekly level. So just to put that into context, it took our like one data collector about 1 week to collect the data on just one single county at the weekly level for 2 years. So it would take one data collector about 7 years to collect all the data for our entire data set. Luckily, we had more than just one data collector, but that allowed us to really much more quickly put together this data set. And then also kind of in having multiple data collectors and doing this as a team, we implemented procedures like intercoder reliability and double coding of certain counties just to ensure that data was collected correctly and that any discrepancies were corrected systematically. And so I think that just adds a lot of value, just all that time and detail-oriented approach to such nuanced and rapidly changing data. And then on that same note, just the policy landscape during that period of time was very volatile. And so the websites, government websites, whether they're local, federal, state, social media, we know that it's constantly changing, and what we see today is not what was posted on that government website back in, May of 2020. And so part of our data set, or part of our database was using a tool called the Wayback Machine, which is an online internet archiving system that's free to use, and not only archive your own websites or websites you are using, but go back to websites and see what they were like in prior dates. And so I think just the fact that we've kind of saved those citations in time also helps kind of with the robustness and the ability to go back and double check things and have those resources there. And then third, we as part of the data set, we also constructed comprehensiveness policy exposure scores, not only on whether or not counties had certain policies in place or not, but the stringency of those policies. And so I think that is also adds a lot of value in terms of how to discuss and handle so many different policies in kind of like one neat package and way to define policy exposure. And just on your second point, just about ways in which someone else could build on the data. We know that another group is working on adding 2022 data. Of course, there's also a lot more counties than just 309. So we could always add more counties. And we also hope that in publishing our data collection methods and how we created these scores, maybe this methodology could also be helpful for other groups who want to do something similar with other types of policies or other periods of time, or even different geographies like the city level or state level, something like that.
Yeah, thank you. Thank you. This was a really interesting question. I love to see the commonalities across some of your responses. And in particular, I just wanted to highlight as kind of a key value add for each of you, just this the kind of theoretical approach that you have brought to building indices that you have added onto your data. So Lindsay, we heard this from you in terms of the disadvantage and affluence indices. But Laura, you also spoke to us about some of the sort of testing and validation you did in your selection of questions. And Caitlin, I hear this a little bit from you as well in terms of, you know, the work that went into building the stringency index, for example. And I think that's such an important kind of value add for the data that you're creating. And yeah, love to hear it and just wanted to point that out. Okay. So thinking back on when you were creating your data, can you tell us a little bit about a challenge you faced working with one or more of your data sources? So what's a hassle that you saved others from if they reuse your data instead of going back to the source? And Laura, I think you alluded to this a little bit, so I'm going to let you start kind of that the hassle that you experienced with, I think it was your crosswalk. Yeah, do you want to tell us a little more about that?
So we had to, some occupations matched between the two classifications pretty easily. A lot of others really required a like one by one type of analysis. I think we had over, I think we had about, yeah, we had about 1,000. And so it took quite a bit of, you know, tedious work. And to be quite honest, it wasn't like it was a couple of brains working on it. It wasn't as straightforward as you would think. So I would say that's definitely, and you know, and it's also the part where I feel like I can say I learned the least out of all this process, so I'm so happy that it's one and done. So I would say that's definitely the most challenging part. Again, I was a student, so a lot of this was an amazing learning experience for me, and I'm so happy I did it overall. But okay.
Thank you. Caitlin, I feel like you maybe touched on a bit of this already as well, just in terms of the volume and variability in the public data that you were collecting. How about you? How would you describe kind of a challenge that you experienced with your data?
Yeah, I definitely think that was the biggest challenge. Just the fact that you couldn't consistently go to one source and get all your information for all the types of policies for all the counties. So it really kind of took a lot of perseverance and kind of creativity too on the part of the data collectors to know how to go to all the different types of sources. And then even if you made it to like a page, it might have been updated from a month ago or a week ago. And yeah, the Wayback Machine was really a huge tool. So like I think data collection took place in 2022, so it was all retrospective. And so someone could go to a county's public health webpage and then check on the way back in the Wayback Machine, kind of copy and paste that URL and check to see which dates in the past the Wayback Machine had archived that page, and then you can go to that page and see what it looked like, you know, back then. And I think that was an awesome tool to have and really allowed us to overcome such a large challenge with this type of data collection.
Yeah, thank you. Lindsay, how about you?
I have to echo what Caitlin said as well. We We have a lot of data sets that use one or two data sources, but we also have several where we're going to different county health department websites or a variety of different websites, or our data is longitudinal from 1990 through 2023, very close. We're working on a data set through 2023 right now. But oftentimes there's a lot of missingness, especially when you go back in time, and inaccuracy. Like the older the data, the source data is, the more likely it is to have some errors in it. But also sometimes the data collection methods have changed throughout time. So we have one data set called the Home Mortgage Disclosure Act longitudinal data set, and that's data about who is getting mortgage loans from 1981 through 2020. And the federal government, I think it was the federal government, had three different methods of data collection. So the researchers on that had to normalize all that into like one, one sort of metric. So that's one thing. Another, like source data isn't always very clean and tidy. It's often very, very messy. We recently published a series of data sets using the National Establishment Time Series database, and it's very useful data, but it had a lot of, it was super messy, and it took us, I think, almost 2 years to clean it. We're both cleaning it and running these scripts to clean the data and having conversations about these novel methods that we're using to clean it, and then figuring out how to write in our methods to our users about what we did, and then figuring out which sort of topics to go together. So yeah, we do a lot of tedious things.
Great. Thanks, Lindsay. Okay, so in addition to the data that you all have shared, so each of you has other resources that accompany your data that would be helpful to others looking to reuse it. Some of you have user guides or code or training materials or reports, publications, other things. Would you like to tell us more about any of those? Laura, let's start with you.
So I will, a lot of the material that it's supplemental and it's not already on ICPSR is as part of the publication. So I put the DOI link. This was a paper that was published in Demography in 2022. A lot of the supplemental material will be on the online appendix. So in the online appendix, you will find more details on how we did the crosswalk. And we listed the questions that we used to build the face-to-face and remote work index. We also talk about a similar index that was built by Dingle and Neyman in the same year. They call it teleworkability. It's a little different. We listed the questions that they used as a helpful comparison to those that we used. And then we put two big tables that show the top and bottom occupations for both face-to-face and remote work based on the tasks. So it's nice to see, this was mostly a check that we did. It's nice to see that the bottom 5%, face-to-face occupations really look like the bottom 5% of face-to-face. So for instance, we have moving workers, logging workers. So these are occupations that really cannot be done in a non-face-to-face manner. And then the top ones are aircraft pilots, meeting convention and event planners, excluding medical profession, including medical professions. Most of the top 5% face-to-face are from the medical professions. And then we did the same for remote work. So that was a nice way to check. And then everything else is really in the server already. There's a README file. you guys are more than welcome to ask me if you have further questions.
Thanks, Laura. Lindsay, how about you?
Yeah, I'm gonna just drop the Nanda website into the chat. So we do have methods handouts that go with all of our data sets. So especially if you're accessing Nanda through a secure enclave, make sure that you find those methods handouts because they're super helpful. But we offer a yearly workshop. We had our first one last summer in August, so we'll probably start planning the one for this summer in the next few months. If you're at PAA, we'll be at PAA. We love to talk to folks. But I think probably the thing that I think our researchers really enjoy using that I've seen be the most useful and impactful to our users is our monthly office hours. So we have 20-minute slots once a month where anyone can just sign up to come hop on a call with us and tell us your research question, or what issues you're having with the Nanda data or whatever it is, and we'll try to talk through with you the solutions or help you figure out which data sets might be most useful to use. But we really love engaging with our users. So that's one thing that we do that I think is super cool and useful. But we also we really pride ourselves on our accessibility. So we try to respond to anybody that shoots us an email within like 24 hours, and we do our best to help all of our users. So even though Nanda is a very small team, if you're looking at it and you have a question, we'd love to hear from you, because we want as many people as possible using it.
Thanks, Lindsay. Caitlin.
Yeah, so we have put kind of our key resources on the same page as the ICPSR kind of data download where you can access UCCP. Our documentation manual gives sort of an in-depth look at how the methods around data collection, and then our user guide is more geared towards those who are interested in just downloading the data and applying it. So it talks like a lot more about the sampling process, how we coded the policy index scores and the stringency scores. Also how to report any corrections if you notice something is wrong or not what you would expect. And I know Lindsay talked briefly to the question before about missingness, which we also had to deal with as well. And so in the user guide, we talk through kind of how we handled missingness. We had a protocol of implementing the state level policy for any county level week that was missing that policy score. So details like that that are just really, really helpful when you're getting into the nitty-gritty of understanding and using the UCCP.
Great. Thank you. Okay, I'm keeping an eye on time. Okay. So I think we have time for our two remaining questions and then a bit of Q&A. So let's give it a shot. And I especially, so I want to give you a chance because I think this is important to share any advice briefly that you have based on your experience with your data. Do you have advice for other people who are sharing data that they generated from other publicly available data sources, or advice for people who are interested in using or building on your data? Lindsay, why don't I start with you on this one?
Thanks. I have two pieces of advice for folks that are looking to share their data. The first thing is it's never going to be perfect. You can spend forever trying to make it perfect and to fix everything. And once you hit the publish button, you'll think of one more thing that you could have done to make it better. So put out the best product that you can, and there's always room for version 2. And then second, I said that we really pride ourselves on being accessible. That may also be a fault. One of the hardest things about managing an open access data repository is that I don't know what all the research questions that everyone is going to ask that is going to be using our data is. So no matter what we end up publishing, it's not going to work for everyone. We would love for it to work for everyone, but it just won't. That would be impossible. So anytime we publish something, we're going to have someone reaching back out and saying, hey, it would be really cool if you could do X instead of Y. And then we just have to ask ourselves the question of, okay, would addressing this one user's question make this data more accessible to the general public, or is it just helpful to that one person? So those are my two things.
Thanks, Lindsay. Laura, any advice you want to share?
I mean, Lindsay already touched on most. I would only add, the easier the README and the files are to read, the better. So I had to learn a lot about this. I would say for people who are trying to make this their data public, I would probably have some student or some colleague going through it, someone who's completely outside the project, being able to like going through it and check that it's actually outsiders proof.
Great, thank you. Caitlin, how about you?
Yeah, those are all very good pieces of advice, and I would echo those. I think it takes a lot longer than one might think to create your own publicly available database to share. But it can definitely be worthwhile. So I think also to having systems in place for when and if corrections are needed is also really key, and just makes things more transparent. And the goal is just to have as robust of a database as you can. So, being able to correct for errors is an important procedure to have in place. And then I can't stress how important like the additional documentation is. And then also, having other publications that have, looking at those can also be really helpful too for someone that wants to like use UCCP or other publicly available data sets, is looking at what's already out there and how other people have leveraged it. That as like personally from experience has given me such a breadth of knowledge on how to apply different data sets in different ways for different research questions.
Great, thank you. Okay, heads up to our attendees. This next question is the final question I have. So soon it'll be time for your questions. We have a couple of questions in the chat already. So, but if you haven't already done so, please drop your questions in the Q&A box and I'll read them to our panelists to respond. So briefly for each of you, what's next for your data? Are there updates or publications or reports that we should be on the lookout for, or new data that you're planning to create and disseminate? What's coming next? Caitlin, I'm going to start with you on this one.
Sure. So we have, and I think these are all posted on the ICPSR website. We now have 4 or 5 publications from our research team on a couple different analyses using this data set. One was trying to measure and describe longitudinal trajectories of local county policymaking. And then our kind of next phase has been to link the UCCP with other health data sets. So currently we have it linked with 4 nationally representative health surveys, including NHIS and BRFIS, MEPS, and NISDA. And we're in the midst of multiple different analyses looking at the associations between local level policies and behavioral health, child nutrition, and a couple other outcomes. And we are doing all of those analyses at the RDC. So which is the federal RDC in Boston. So we're using restricted use data and merging it with the UCCP at the county level. So that's opened a lot of doors in terms of next steps and analyses, looking at health outcomes specifically. But I definitely invite folks to look at the papers we've published thus far. And we also have some information on the Sphere website, the Social Policies for Health Equity Research Center, which is where the PI of this project, Dr. Hamad, works. So, yeah.
Thank you. Laura.
In the pipeline, I am working on a grant proposal where that has as the goal that of standardizing across the US states the job of health paraprofessionals. And I thought I would use ONET to look at the tasks and find other occupations that are actually in the survey, because this one isn't, that are very similar in tasks to the health paraprofessionals, and so that I can build information on, a fair wage, fair training, amount of hours that they work. So it would also be an interesting way to come up with a method that helps us standardize new occupations based on similar existing ones.
Thank you. Lindsay, anything you'd like to add?
Yeah, Nanda's always got something up its sleeve, so I could talk for the whole next 8 minutes about all the stuff that we're working on. Or if you're interested, hop on over to our website, and we have a news page where we post sort of updates whenever we publish a new data set or have a significant paper come out. We're also on LinkedIn, Blue Sky, and Instagram if you're doing any social medias, and we try to post updates there as well.
Cool. Thank you. All right, we have a few questions from our audience, and I want to start with a question about support and funding. So, would any of you like to speak about how your work is supported or funded from when you started through now, especially given, this person has pointed out that it's harder to find funds to maintain data collection and infrastructure and to do this work in real time?
I can briefly share. So the UCCP is part of funding from an NIH grant. It was one of the aims of a 3-aim grant that was accepted and approved. And so that is how it was a long process, and we're still within that grant cycle. So, but that's at least how we were able to fund the UCCP project.
Anyone else like to? Yeah, go ahead.
Yeah,
Sorry.
I was not funded. I was, working as a academic, and I think most of my co-authors also. So our project was not really backed up by grants, this one specifically.
And Nanda is funded on an NIH U01 grant right now, and we also submitted an NIH P01 project proposal about a month ago. So pray for us or send us good vibes.
Thanks, folks. I'm going to take a quick question that we received about depositing data with ICPSR. So can you deposit data with ICPSR that is non-COVID health data? The answer is yes. We take data from a variety of topics, largely in the social sciences, but we do have some health and health adjacent data as well. And yes, you can absolutely deposit data with ICPSR, and I will post a link on momentarily in the chat for how to get started depositing data with ICPSR. Okay. And another question that I believe will probably be our last one for our panelists. Are there drawbacks to using a secondary compiled data set rather than the primary source material?
Go ahead, Caitlin.
Oh, I was just gonna say, I mean, I always think when using data, I kind of have this voice in my head from years of training that's like an analysis is only as good as like the quality of the data. So I think if you're there's a lot of transparency around the secondary data set in terms of information, how it was built, all that stuff. I think then you can have more confidence in it being a powerful tool and having less drawbacks. That being said, if you find a data set and that's lacking, I could see that as a potential drawback of using it. But I don't know. I think secondary data sets can be very powerful. That usually outweighs a lot of drawbacks.
Yeah, I'd echo what Caitlin said, for sure. Like make sure that it's transparent and you can see where they got all their sources from and their documentation and everything. And then I think it really truly depends on your research question, your skill set, and your time frame. I think the beauty of secondary data a lot of times is it eliminates, the first steps. Like, why are we all starting at the creating the data set page when we really just want to be answering research questions? And so, yeah.
I think I mean everything has been said. I think just being aware, usually researchers do a good job at highlighting the limitations of their data, and I think just being aware of those and if those can be a deal breaker in your current project, that maybe not use secondary data. Otherwise, I think there's a lot of power in using already prepped data for you.
Well, thank you, folks. Thank you so much, panelists, for your time. Thank you to our audience for being here and for your questions. I know Chloe has just a couple of final logistical details for us. So Chloe, I will turn things back over to you to wrap up.
Thank you, Megan. And thank you all for attending our webinar. And also a reminder that this presentation will be added to the ICPSR YouTube channel. Otherwise, I hope that everyone has a wonderful day.